Hi, today is Tuesday, October 13, and I'm here to congratulate you. Everyone working together, and Stanislaus County has entered into the red tier. So I want to thank everyone. I know people have had to give up a lot of things. They've had to give up celebrations and sorrows together, being with family and being with friends. So I really want to thank you very much for making this day possible. So what does it mean that we have entered the red tier? And excuse me, but I'm going to have to look so I get this correct. It means that all retail can now open at 50% capacity. It was 25, and now it will be 50. Personal care services can open up under the guidance with modifications, and so look to the guidance to see how to open up safely. Restaurants, places of worship, and movie theaters can open up at 25% capacity or 100 people, whichever is fewer. And gyms can open up at 10% capacity. All of this information is available at covid19.ca.gov. If you click on what's open in my county link, and then you can put in Stanislaus and you can page through and see what's open, and it'll be very specific as to many different sectors. But those are the big ones we just touched on and the changes we'll see in our community. Schools, for schools to be fully open, under the guidance, we need to stay in the red tier for 2 weeks. So if we continue on the course we're on, in 2 weeks, schools will be allowed to open under the guidance. And so that's great. What's next after this? Where are we going? So what we're hoping is to continue on into a less restrictive tier. Orange would be our next goal. So are we going to make it? How do we feel about that? I have to tell you, I'm unsure. As I look at the data, it seems that we've kind of leveled off maybe with even a little bit of an increase over the last week or so. And so I'm a bit concerned that we may not continue our progress. And I'm truly hoping we can to get to the orange tier, and it's going to take all of us. So the way forward, as we know, are those messages that we keep talking about, those things that we can do that really don't cost us anything out of our pocket, so they're not expensive, but they are a change in the way we conduct our everyday activities. We need to wear a face covering whenever we're away from our homes and in places where we're mixing with people not in our household. We need to keep a 6-foot distance at least from everyone not in our household. That is just key to stopping spread. We need to wash our hands frequently with soap and water. If that's not available, a hand sanitizer is great. Limit mixing of people outside of our household. The state put out guidance on gatherings of 3 households, which is just wonderful to be able to gather, but try to remember that outdoor is best always, face covering, 6-foot distance, wash your hands, stay home if you're not feeling well. Stay home if you've been exposed to someone or been diagnosed with COVID-19. Follow the isolation and quarantine guidelines because they're so important for us to continue moving forward. And testing. Get tested if you have any symptoms. Get tested if you've been exposed. Get tested if you're in a work site where you can't keep a 6-foot distance at all time, or you're frequently interacting with people not of your household, like with the public. And if you gather, get tested and know your status, know your COVID-19 test results so that you are not being part of the spread, that you can be part of our solution. And finally, a flu shot. The great thing about all these measures that we've talked about, first of all, is that they will help us prevent all respiratory viral infections. It's not just COVID. It is flu, it is RSV, it is adenovirus. All these measures will help us to keep low and stop the spread. The flu shot, we have a shot for one of these to prevent infection, and that's great. So hopefully everyone will go and get their flu shot. Now is the time. The symptoms are so similar to COVID, you won't be able to tell if you have flu or COVID, so get your flu shot and at least eliminate one of those viral infections. So your actions, all of us in this community, have made a difference, and we all thank you. Together we can continue to move forward and move into a less restrictive tier and feel that our lives are a little bit normal. Thank you everyone for doing this. Your actions really have made a difference.